Hello people, in this video let us look at the 10-mark question here, long essay. Right atrium, you have to explain under the following headings. So what are they asking? About the heart, about the right atrium. They're asking its external features, internal features, blood supply, and the thrombus formation, why it happens. Okay. The anatomical basis for the thrombus formation in right atrium. Okay. So first of all, when was this question asked? In November 2023, final exam, anatomy. So it is an important question. Okay. So first of all, as it is 10 marks, you will have to write a lot, correct? So give an introduction, and always you have to draw diagram. So I'm assuming you know how to draw heart. So first let us draw of heart. That will give us a clear picture even in our mind how to draw. So here is the heart that I draw, which is very beautiful, Valentine's Day type. So this is going to be the right atrium, correct, which is in our our topic currently. So here you will show that the right atrium is getting superior vena cava, inferior vena cava input, right? Then here you have the pulmonary artery from the right ventricle. Here you will show the aorta from the left ventricle. Okay, this is how I usually draw. You can draw how you want, okay, and label it very beautifully and nice. So here, what is the topic of discussion? It is the right atrium. Okay. So now coming to right atrium, what is it? It's the right upper chamber of the heart. It receives the venous blood from the whole body, that it is receiving the deoxygenated blood from the whole body. From where? From the superior vena cava and inferior vena cava mainly. And then from the right atrium, the blood flows into the right ventricle via the right atrioventricular valve, or that is the tricuspid valve. Okay. So this is some introduction that they have given you. That's all. Input they have told, output they have told, to where the blood is going. So now let us come to the actual parts that they have asked. They have asked about the external features of the right atrium. So externally, what will you see? Here you have to, guys, focus here. You have the superior vena cava that you are seeing here, and then you have the inferior vena cava that you are seeing. Where is the inferior vena cava? Here. Inferior vena cava that you are seeing. So what and all do you see externally? Superior vena cava, inferior vena cava. Then you have something called as the right auricle, like as though it's an ear type of a thing. Here, right auricle, this point here, like a flap. Okay. So the auricle covers the root of the ascending aorta. So this auricle is like hugging, like a hand, shoulder on the aorta. Okay. So what word you will use here? Right auricle you will be able to see. So superior vena cava, inferior vena cava at the lower end. Don't forget to draw a diagram. No need to draw this closed external features. What I told you in what we just drew. Okay, something like this. This is enough. Okay. How's it going, people? Is it going fine? What are we looking at? External features of right atrium. Very important. Right atrium is question for exam. So now let us continue here. So right auricle is over, right? Then I'm not going into the details. You just write little of everything. Then coming to the sulcus terminalis. This is another word they're expecting you to write. So there is some groove here that they are saying, sulcus terminalis. So from the superior vena cava to the inferior vena cava, you have the sulcus terminalis. Is it marked anywhere here? From the superior vena cava to the inferior vena cava, there is some groove. Okay, sulcus terminalis. This is actually because of some muscular ridge called as the crista terminalis. Okay, so crista terminalis, okay, produces the sulcus terminalis. So in the upper part of the sulcus, you have the sinoatrial node, that is the pacemaker of the heart. Remember it is sinu, they have written textbook, sinoatrial node, and this is going to be the pacemaker of the heart. So remember that the pacemaker of the heart, you will write in where? In the external features. Don't write off in the internal features. Currently we are looking at the heart from outside. There itself you will write the sinoatrial node. Okay. So what and all you saw till now in the external? Very good. Superior vena cava, inferior vena cava, right auricle, crista terminalis, the groove sulcus terminalis, and then the sinoatrial node. Now we'll go to the last point here in the external features. That is the right atrioventricular groove that separates the right atrium from the right ventricle. So this is also something that you see here, some groove here. I'm thinking this is that groove. Between atria and ventricle means this one only, no? So the right atrioventricular groove separates the right atrium from the right ventricle. Okay? This is almost vertical, they are saying. Okay. In the external features only about sinoatrial node, you can say a little more. It is the pacemaker of the heart. It generates about impulses in the 70 to 100 beats per minute. That's your normal heart rate, right? It should, and it is horseshoe shaped, they are saying. And where is it? It is in the atriocaval junction. Okay, in the upper part, that is near the superior vena cava, you can say. Okay, near the superior vena cava. Where is it? Sulcus terminalis, upper part. Okay, upper part of sulcus terminalis. This we already told you, right? So from here, where will the impulse go? To the AV node. So from SA node, it will go to AV node, but that is not our topic of discussion here. Here our topic of discussion is what, people? Right atrium only. So what and all did they ask you? They have asked you the external features. We are done. Done with external features. Very good. Now take a clap. Very good. Now let us go to next part. Internal features. You went inside a right atrium. So what you're looking at? You're looking at the cut part of the right atrium. Now what is there that you're seeing? Posteriorly, you should see something. The wall. Posterior wall you're seeing here, right? The posterior part. This is smooth. Okay, and here all the veins will open. So it is called a sinus venerum. Okay, all the veins will open here. You're able to see, no? Let me zoom. So the posterior wall is the wall, W-A-L-L, posterior part. No, they didn't say wall. Posterior part, that one is smooth. Okay, that is the posterior. Then coming to anterior part is there. No, that is rough. Okay. We'll come to that. Anterior, it is rough, which we have removed here. What you're seeing is posterior, which is smooth. Then you have the interatrial septum. Okay, people. Where is this interatrial septum? Here, between the two atria, you'll have interatrial septum, right? And then what else is left for you to know? Between the atrium and the ventricle, here you have the valve. Okay. So inside, I think when you say internal features, you can explain this atrioventricular orifice also. That's the tricuspid valve opening. Okay. Now. So now let's get started with smooth posterior part or sinus venerum. So now let us zoom and enter the heart. Okay. So what and all you have here? The veins, all the deoxygenated blood has to come here and drain, right? So this is the superior vena cava. Here you have the inferior vena cava, which is guarded by this eustachian valve. It's a rudimentary valve, by the way. Then you have the coronary sinus, that is all the coronary veins, right? So that big one. So that is again draining here. You have that is the Thebasian valve. Okay, Thebasian valve, which is guarding this opening, that is the coronary sinus. Then you have the venae cordis minime, which are the small cardiac veins, which have collected all the blood. That also will drain into this posterior part. Got it, right? In fact, this venae cordis minime, it is taking the blood from all the four chambers of the heart. Okay, after the supply to the heart muscles, right? Then it is draining into the right atrium, obviously. So almost everything drains into this except the anterior cardiac vein, that you can remember. Okay. Then you have something called as intervenous tubercle of lower. Now what is this? In the posterior wall of the atrium, just below the opening of the superior vena cava, there is something called as some intervenous tubercle of lower, but it is actually here on the top. Wait, I'll show you. Somewhere here they are saying here's near the opening of superior vena cava, there is something here in the posterior wall, intervenous tubercle of lower. If you remember this, you can write. Okay, very good. Now posterior wall you have done. Okay, everything opens there. Veins. Very good. Now let's come to anterior. See, anterior is rough. It's called as pectinate part, and it also includes the auricle. Auricle you saw, no? On the external surface you saw that auricle, right? So it includes that, they are saying. So here what you should know, it's rough. Okay, it's rough. So basically because it is rough, you can just remember muscular ridges, musculi pectinati. Okay, musculi pectinati, muscular ridges, transverse. So that's something that can give you a why rough pectinate part. Okay. So again here only they're talking about all those valve, right? For the valve, what and all is required. All that seems to come from here. Which valve? Atrioventricular valve, right? For that. So basically don't go much into this, okay? Just remember some musculi pectinati, so pectinate part, so muscular, so very rough, so rough, transverse muscular ridges, like that you can remember. So this will continue into that muscle, this one, which is helping this valve. So you can see here, correct? This diagram. So you can just remember like that. Now let us go to the interatrial septum, that is between the two atria. So what is there between the two atria, people? Interatrial septum. Very good. Now you have to understand that. So let me draw here and explain. So if this is the beautiful heart, correct? And here you have the interatrial septum. Where is interatrial septum? Smart people, tell me. Here you have the interatrial septum, that is between the right atrium and the left atrium, correct? Now here what and all is there? In embryonic life, you know that here there is a foramen ovale, correct? So some people will have remnants of this foramen ovale. It is possible that they have a remnant of the foramen ovale. But for most people, what should be there here? Just a sulcus, kind of a depression should be there here where the foramen ovale was present. So this will be called as what? Fossa ovalis. It should be oval, I think, more oval. So fossa ovalis, which is the depression. Okay, and around this you should have you can have a margin which is very visible, that is the annulus ovalis or limbus fossa ovalis, prominent margin of the fossa ovalis. So what and all is there? Annulus, limbus, fossa ovalis. Then you have the fossa ovalis. Some people can have the remains of a foramen ovale. Okay, so this much should be there in this interatrial septum. How did the interatrial septum get formed? From the septum primum, septum pet secundum. It is derived from these two that you will learn in embryology. Okay. So basically, internal features we are done with interatrial septum. Now let us go to the fourth part here that we have written. Right atrioventricular orifice, that is between the atria and ventricle. The atrioventricular orifice, that is here. You have the tricuspid valve, right? So you have the tricuspid valve here. The tricuspid orifice is guarded by the tricuspid valve. Okay. So how does the blood go from the right atrium to the right ventricle? So you are done with the internal features of right atrium. Clap for yourself. Clap for yourself. Good. So now let's go to the next part of the question. The next part of the question is blood supply. And you know what blood supply they're asking here? The blood supply of the right atrium. They're not asking of the coronary arteries of the heart, the blood supply to the heart. No, they're asking only right atrium. Who will supply? Who will supply? You only tell. I know, ma'am, who will supply. Who? The right coronary artery. Very good. Very good. You can say that the atrial branches of the right coronary artery, which is the atrial branches of the right coronary artery, right, will supply the right atrium. Also, here you have a branch to the SA node, correct? The right coronary artery also has branch to the SA node. So if you remember, so this is the right coronary artery arising from the anterior part of the aorta. You can see here, you just say, okay, it is coming off the aorta anterior part. Then you have the atrial branches which supply the right atrium, and then you have the branch to the SA node which will supply the SA node, right? Then again it will go forward and become the marginal branch, interventricular branch. So many other branches are there which we don't need here, I'm thinking. Okay, now coming to blood supply means you should not only explain the arteries, you should also explain the veins. Very good. So here you have the cardiac veins, coronary sinus, venae cordis minime, which is small numerous veins present in the walls of all four chambers. Guys, I think when they are asking blood supply of right atrium, no, you also add this right marginal artery, okay? And I have a feeling when they have asked right atrium blood supply, they are not talking about the coronary arteries which are helping the right atrium work. I think they are asking you from where the blood reaches this chamber. So it is not very clear, right? So what you do is you tell how the blood reaches right atrium also. So you can draw one extra heart here, a diagram, and you can just explain the same thing again and again. This is the superior vena cava carrying the deoxygenated blood into the right atrium from the upper parts of the body. Then you have the inferior vena cava, which is carrying the blood, deoxygenated blood from the lower parts of the body. So this is the SVC and the IVC. Then you have the coronary sinus, that is the largest coronary vein, right, which is from the heart itself. Then you have the venae cordi minime, that is the small veins from all the chambers, right? They open into this right atrium. Then talk about the right marginal vein, that is nothing but your cardiac vein. And then you have the anterior cardiac vein. So all these open into the right atrium. So this also you have to talk about. So when they talk about, you understood what I said, right? When they are asking you about blood supply to right atrium, it is not very clear whether they want the functioning of right atrium itself or the content of the right atrium from where it is coming. Okay. So you got the blood supply to right atrium, how to answer. People, in this video, look at this question. Anatomical basis for thrombus formation in right atrium. Why in right atrium there can be thrombus formation? They're asking you anatomical reasons. Okay. So first understand this. The right atrium is something that receives blood from the body, right? Superior vena cava, inferior vena cava. It receives even the veins, cardiac veins themselves drain into the right atrium. So right atrium is receiving a lot of things. So any thrombus anywhere, it will reach right atrium, correct? In the heart, first place it will reach us the right atrium. Okay, then in the external features, you have read that here you have the right auricle, correct? You see this extension here, you have some right auricle here, right? This, and then here you have something called as a muscular ridge between the superior vena cava and the inferior vena cava. You have a crista terminalis, right? Which is in this groove called sulcus terminalis. Okay, it causes a groove called sulcus terminalis where you have the SA node, correct? So this muscular band also could be one reason for the thrombus to form. Okay, then we just now told you that there is a sinoatrial node here, sinoatrial node here. This itself can lead to what? Fibrillation, atrial fibrillation, which can lead to a thrombus or clot in the right atrium. So you're understanding why and all there can be a thrombus or a blood clot in the right atrium, correct? Next. In the internal features of the heart, you have seen that there are in the posterior wall, a lot of openings are there. The superior vena cava is opening. The inferior vena cava is opening via the eustachian valve. The coronary sinus is opening through the Thebasian valve. Then you have a lot of venae cordi minime, right, which are draining into this, because that drains actually all the four chambers, and then it opens into the right atrium finally. So the right atrium is having so many openings, you can understand, correct? So that is the posterior wall has all those openings. Anterior wall, what happens? It is actually rough. Anterior wall you're not able to see here, right? In this diagram, because we have shown you a cut diagram here. So anterior wall is actually rough and pectinate. So it is having muscular ridges, okay, called as musculi pectinate. Okay, so you can understand it is a rough. So there's a lot of nidus in the right atrium for thrombus formation. Okay, then the septum itself, the interatrial septum itself has what? It used to have the foramen ovale, in the fossa ovalis, around which you have the annulus ovalis, etc. So many structures there. You're able to understand. So all these reasons, all these things can be a nidus for thrombus formation in the right atrium. Okay. Then what other reasons can be there? Okay, not anatomical exactly. So basically sometimes they will put central venous lines, right? You would have seen in ICU, etc. That can be a cause. Medical devices, some mechanical valves. Some people can have pacemaker leads, the electrodes, whatever they are calling, right? So those things can be the nidus again for thrombus formation. Then if there's endothelial damage, atrial fibrillation, stasis of blood, hypercoagulable states of blood, so the blood itself is hypercoagulable, all those can lead to thrombus in the heart, especially in the right atrium, which we are focusing now. Okay, so I hope this question you will be able to answer in the exam. Basically, remember, the right atrium receives blood from so many things, so it is the first place that a thrombus can even reach if it has formed somewhere else. And so many openings here, so many types of valves, and then I told you muscle, crista terminalis, and then what is that? You have the muscular ridges in the anterior wall, then some right auricle you have, then you have the sinoatrial, interatrial fossa ovalis, etc. So many things that can finally lead to this thrombus formation in right atrium.